Coming up, we'll be on location at the Advanced Asthma, Allergy and Sinus Center in Maryland, discussing the advances in asthma and allergy treatment and how they can effectively diagnose and treat many allergy and asthma-related health problems with one of this area's top doctors, Dr. Neena Bhatti. Dr. Bhatti is a board-certified allergy doctor and completed her residency and fellowship from Howard University Hospital in Washington, D.C. Dr. Bhatti is widely recognized as one of this area's leading doctors. Welcome, Dr. Bhatti. It's a pleasure having you on our program.
Thank you so much for having me.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. We have some patients we're going to be hearing from a bit later. But I wanted to begin, if I may, Dr. Bhatti, by having you please tell us what some of the most common types of allergies that you see in the patients.
Well, in the region, I've been practicing for the last 15 to 20 years, and the most common allergies that I've encountered in my practice have been allergic rhinitis, eczema, and asthma.
And what are some of the causes for these allergies?
Well, the most common, I would say, is you believe it or not, it's the perennial allergen, which is the dust mite. And we also have indoor pets like cats, dogs. Then the other most common allergens would be, of course, outdoors, which includes your grass, your tree, and your ragweed pollen.
Very interesting.
And mold, of course.
Yes. And is there a typical candidate, or can anyone develop any of these types of allergies?
Well, the most important prerequisite for that would be a genetic background. That means that you might have a family history of allergies, and that makes you more prone to developing an allergic response to whatever you are encountering in the environment. So I would say that yes, a family history is a prerequisite for majority of the people that develop allergies. And then, of course, the environment, which is very, very rich in the pollen that we encounter during the seasons.
Yes, indeed. In fact, this region, Washington, D.C. metro area, is considered one of the worst when it comes to that.
It absolutely is.
Now, we've been asked this by a number of folks, and I wanted to ask you, the expert, this specifically. Can adults that have never had allergies in their lives develop them later in life?
Well, that's a very interesting question, because we do have patients that have claimed to have never developed allergies to foods, and then all of a sudden at a later age they would develop an allergy to food, especially the shellfish. Now, we do have different peaks of allergic rhinitis development, which is early on, which is under the age of 18. And then we have the midlife, and then believe it or not, it's about 40 to 50 years of age that they would develop a late onset of allergies. And again, it depends on sometimes their place of residence. They might have moved from a state that did not have too many allergens, like Arizona, and it's a desert, doesn't have too many outdoor allergens. Might have relocated to Maryland, and they all of a sudden that genetic link to the allergies comes full blown, and it portrays itself as having, you know, a clinical onset of allergies.
Yes, indeed. In fact, that's a great point, because you're right. Arizona, the example you gave, you're talking about a lot of dry air as opposed to over here in this region.
Absolutely, absolutely.
And what type of symptoms should we look for if we feel, you know, an allergy coming on? Is there something that you can let the viewers know that they should be aware of? So
the most common symptoms that patients come in with are usually the nasal itching, nasal congestion, runny nose, itchy eyes, and a lot of times the skin manifestations of urticaria, which is the hives that they would develop, and sometimes it's just developed during the season that they're most affected in. And then eczema, you know, sometimes will be 50% of the times connected with an allergic predisposition of the individual, and then it just manifests itself during the seasons sometimes.
Okay. And how do you test for allergies, Dr. Bhatti?
Well, we commonly would like to do a skin test, which is very, very sensitive in picking up the allergens that the patient is very sensitive to. Let's say if a patient comes in and they just cannot be off their medications, then we have an option of ordering a blood test, which is called an immunocap. And the immunocap is very sensitive in also picking up the allergic reactions to any number of allergens, whether it be the food allergens or it be the indoors or the outdoors. So we have that way of diagnosing as well. But like I said, the office-based procedure is a very comfortable way and very quick way of finding out what the patient might be allergic to. So that is the one that we go to normally.
And certainly good to know indeed. And what are some of the most effective treatment options that you offer that can help so many folks out there?
Well, we always give the options to our patients of medications, okay? So we have a therapeutic plan that we always give to every patient of ours that comes into the practice. But then we always tell them that if you're very allergic and very, very sensitive to your allergens and you stay sick 4 months out of the year and miserable, then allergy injections are a good way to go. And now we also have an option not just of allergy injections that are very, very minimally invasive way of desensitizing somebody to their allergens, but we also have 2 allergens that we can do oral therapy on. You know, one is ragweed and the other one is a grass pollen. So those are actually allergy drops. You know, they are the ones that are made of the ragweed pollen and the grass pollen, and we can administer that at home, okay? So let's say if we have a patient who's only sensitive to grass and ragweed, we can pretty much prescribe the oral desensitization method, and those could be patients that cannot come into the office, that would like to be on a therapy that they control, or they fly out of the country or they fly out of the city very often on business trips and cannot be in the office for the actual injectable form of the immunotherapy. So this is a good option for those.
Yes, so you basically have 2 options there.
Yes.
As you just mentioned, the oral therapy is one route to help folks with those 2 problems.
Right.
Otherwise, it's the injection that we're
It's
looking
the injection. And I would say that we have had over 100 years, you know, that we've done immunotherapy in patients, and it has provided a very, very good benefit, up to 85% recovery of their normal lifestyle, you know, in terms of enjoying outdoors, doing all the activities they would like to without worrying about taking medications.
Yes, because it affects one's life so much.
It does.
In many cases when you're looking at a bad allergy
It does.
situation.
It does. So one of the measures that we have for the efficacy of allergy injections is to see the improvement in the quality of life of a patient. And if you just randomly come in one day into my waiting area and see all these patients getting allergy shots and interview any one of them, and they will tell you how much they've improved with their quality of life.
And that is so significant.
It is. For me as a physician treating allergies on a regular basis, to me that is significant.
Absolutely. And you mentioned a moment ago, Dr. Bhatti, your patients are typically experiencing approximately an 85% recovery rate.
Yes, 85%.
That's very high.
Absolutely.
Great results.
Absolutely.
We're now going to meet some patients of Dr. Bhatti.
I've had allergies for 30 years. They're cyclical, I guess, off and on, but have been worse in the last couple of years. So I cough to the point of gagging sometimes, and it's just, you know, it's uncomfortable for me and everybody else. I take allergy shots, and so I'm having, at the moment, twice a week. Sometimes it'll stretch out. I can go a whole week, but, you know, just I take the shots, and I think it's mostly effective. Every now and then I still cough, and, you know. She's very willing to listen because I know how my allergies have been forever. And so she, you know, when I suggest that it might be helpful not to back off the dose every time we get a new bottle of antigen, she says that's fine. And because every time they back off, then I start coughing again. So she's, you know, lets me suggest a way that might work and listens to what I know about how I react. That's very helpful. Very happy with the office staff here. They're very friendly and almost always on time. I don't have to take 2 hours out of my day to go get a shot. You know, they're very accommodating. So I think Dr. Bhatti at Advanced Asthma and Allergy is very helpful.
My name is Will, and what brought me to Advanced Asthma Sinus Center is I suffer from really bad asthma and allergies. Before I came here, I kept ending up in the ER. I would have severe attacks and I'd have to go there, my throat would swell up and I would get hives and just general, kind of asthma attacks that you see. And having been going to Dr. Bhatti, I haven't been there since. It's really hard to enjoy life. When you have asthma or really bad allergies, you don't know whenever you go someplace whether you're going to have an asthma attack or have really bad allergies to something you ate or something you're around. I live on a farm, and so we have a lot of animals. And during certain times of year, it gets so bad that it makes it really hard to actually take care of those animals. I take allergy shots, and I also take several different medications for my asthma, and it's completely controlled now. Dr. Bhatti's great. She's calm, she's patient. If you have any fear of taking any kind of shots, she'll walk you through it. It's probably the best. I've been to several allergy doctors before, and I really would highly recommend Dr. Bhatti. Do it. Don't put it off because you're afraid of getting shots or you're not sure if it's going to help or whatever. I mean, I don't really have to worry as much anymore about, I'm not afraid of having an attack and ending up in the ER all the time. I highly recommend taking shots. Don't be afraid of it, and the people at Advanced Asthma, Allergy and Sinus Center will help you out.
We're now back with Dr. Bhatti. I must say the patients are very happy with the results. You're really helping so many folks each and every day, doctor.
And that's what we would like to, because we are in the field to do exactly that.
I wanted to ask you, Dr. Bhatti, what separates symptoms from an allergy as opposed to one who has a cold?
That's a very good question, and I'm glad you asked that, because a lot of our patients get confused when they're having symptoms episodically. Let's say, it is the spring and they have a symptom. So usually to differentiate a cold from having an allergic rhinitis condition is that it is not just seasonally. It can appear anytime, and a lot of times people will have fevers. They have fever, body aches, and other issues that are constitutional symptoms that will appear to be a problem when they have a cold. But they might not be there when you're having an allergic episode. So usually there is a pattern that the patient recognizes and comes in to the physician and says, okay, you know what, I've noticed that it only happens in the spring, okay? Yes. It's less likely to have a cold every spring, okay? Even though we tell the patients that the viral infections are very common during certain times of the year, including the spring and the fall going into winter. So the patient might say, okay, you know what, those times I'm pretty good, but my symptoms only appear during my summer season, okay? So then it happens to be every year. So they notice a pattern themselves, and that is a big testimony to the fact that it could be just an allergic episode.
Absolutely. No, that's a great way to differentiate the two. And because, on the surface, you would think with the watery eyes, right? The runny nose, those are similar symptoms for both allergy sufferers as well as folks suffering from a cold.
And you're very right.
How effective are the allergy medications that we hear about that are out there for folks?
So a lot of the medications now are over the counter. We include in the over the counter medications a lot of the nasal sprays that used to be only prescription, but now they're readily available. But the only problem with that is that the patient might not know how exactly to combine the medications, where as a physician we tell them that you can combine a few of these medications for better results. So yes, we notice a 40% to 50% improvement in the symptoms with the patients just depending on the medications. So that does not include the environmental control measures that they could take for indoor allergens, as well as the allergy injections. So by itself, it is probably about 40%, I would say.
Very interesting. And I wanted to now segue over to the asthma component of your practice. So many asthma sufferers out there. I wanted you to please tell us, for those who may not know out there, what asthma is and how it's caused.
Well, asthma is very much an obstructive disorder of the bronchioles, but the good thing is it is reversible, okay? Unlike some of the chronic lung disorders like COPD, for which the most common cause is smoking. That's why I often address that with my patients, even if they come in with asthma. So asthma, like I said, in half the patients might have something to do with their underlying allergies. So for those patients, now the newer therapies that we are using are based on the biomarkers. So a lot of the allergic asthma is based, the treatment is based on the biomarkers. So let's say, for example, we now have biologics that we are using which are injectable. For example, the drug Xolair. And then, of course, we have Nucala and some other drugs, that are injectables. So that has given a very good control to my severe asthmatics and my moderately persistent asthmatics that end up in the emergency room all the time, and they get hospitalized for their asthma. So we now have a lot of good treatments out there, not speaking of the older treatments, which are allergy injections, which in themselves are giving a very good control to our asthmatics as well as the allergic rhinitis patients.
And asthma patients and asthma sufferers, I take it you would diagnose them and determine they have asthma if they are not aware of it when they come to you?
Absolutely. And we use some objective measures, like we do the office-based spirometry, which is our lung function test, that measure how the bronchioles of an individual are working. So it's almost like, if you have hypertension or high blood pressure, then of course you'll measure the blood pressure of the patient. So this tells us not only the initial diagnosis of asthma, but how they're progressing with the treatment of asthma. Then another test we use that is office-based is to measure the nitric oxide in the exhaled breath that they take. And it's called the NIOX testing. So both of those are available to us to measure and not only to diagnose, but to measure the progress of the asthma.
Yeah, because asthma attacks, a lot of people don't realize they can go from different levels of you're talking from a minor asthma attack to a moderate to extreme asthma attacks that can really literally affect one's life in a major way.
Absolutely. Not only the person, but also the caregiver.
Now I wanted to segue at this point of the interview, Dr. Bhatti, to the other component of your practice, and that is that you offer cosmetic and laser skincare treatments as well, you and your staff, to a wide range of patients.
Yes.
And I wanted you to tell us about that.
It's very exciting that you're giving me the opportunity to talk about that, because I just recently took on to that interest of mine because we deal with a lot of dermatological issues in our allergy practice. So I wanted to go ahead and segue into taking care of those patients that are already familiar with my practice and treat their skin cosmetically as well. So we take care of a lot of acne patients. We take care of a lot of pigment issues, including melasma, including sun damage to the skin, and also the aging of the skin, to turn back the clock. Because a lot of my older patients in their 50s and 40s, they wish that they had a younger looking skin. So they come to me with that issue and they talk about their skin. So not only do we treat allergy skin disorders, but we also try and treat some of the sun damage to the skin for my older patients. But like I said, I see a lot of children, I see a lot of teenagers with acne disorder, and that really brings down their self-esteem. So I would love to work on their skin also. So there are many options that we use for many skin disorders. So we use the laser as one of our most, I would say, aggressive approach to the skin, along with doing chemical peels, along with a better skincare that we talk to our patients about, and we provide a lot of guidance into what they should be using with their diet to improve the acne.
Yeah, so you offer various skin, facial rejuvenation treatments.
Yes.
You just touched on a couple of those that can really help people not only resolve, like you said, acne problems, for example, or dry skin, but also can make us look years younger.
Oh, absolutely. And that being a woman is very important to me, So not do I only counsel on skincare in terms of sun damage prevention, but I also treat it.
And what are some of the benefits of utilizing the laser that you offer at your practice as compared to some other treatment options that are non-laser oriented?
So let's talk about the aggressive approach, because like I said, other than the diet, other than the prevention that we can use on our skin, which is using regular sunscreens, we often talk to our patients about the approach with lasers, because now the newer lasers that we have in the market have very little downtime, okay? So the patient can come in during their lunch break and get a laser treatment and go right back to work, so they don't have to be off for that treatment. But it has a big outcome, which is that it takes care of all of the changes in the skin, and with very little downtime, like I expressed before, like with chemical peels, that we use the aggressive chemical peels on the skin, the patient still needs a few days off,
Sure.
because of the way the skin looks and so on. So I think that the newer lasers have given us that benefit that it can be used for all ethnic skin types, okay? No matter what your skin type is, we can use the lasers without giving you that risk of having side effects like hyperpigmentation on the skin and so on. So it is a very effective approach to treating a lot of skin conditions.
And I love the fact that it's non-invasive.
Yes.
And you just touched on it a few moments ago, Dr. Bhatti, for the busy professionals,
Yes.
which there are so many out there watching right now.
Absolutely.
They know they can now come to you, for example,
Yes.
even during their lunchtime,
Yes.
have a laser skincare treatment
Yes.
done,
Right.
go back to work an hour later, and nobody will even know they had something
Yes,
done.
absolutely. So I believe that is the benefit of the newer lasers. And like
Yeah.
I said, I treat all ethnic skin types. So I'm not worried about some of the old side effects that used to come with the laser treatments, which was giving a patient hyperpigmentation and giving them darker spots with the treatment rather than lightening up the skin spots that they have. So a lot of my patients come in concerned with those side effects. So now, at least I can reassure them that we won't see those side effects as often, because like I said, the newer lasers, like the one I use in the office, is the Aerolase, which is the ND YAG laser. And it is so quick and so fast that the laser goes and targets the skin area that we are trying to treat, and it's done. Okay, so it does not leave any residual heat in the skin that is going to generate all the side effects that we used to experience. And the other good thing is, patient doesn't need to be using a local anesthetic on the skin, where we use numbing before the treatment, and doesn't need a cooling gel or any cooling agent to be used, because it does not heat up the skin.
Well, it's through it's through the advancements in technology, and you
Yes.
certainly have the latest and greatest laser right now
Yes.
that you're helping so many people with.
Absolutely.
And who is a good candidate? I know you touched on that a moment back.
Yes.
But a little more specifically for folks watching, who could really benefit from that?
So like I had referred to before, that we treat young patients as well as my middle-age people that are suffering with melasma, with hyperpigmentation based on sun damage that they've had through the years. We treat acne, and we also treat a lot of aging skin, where they just want to look fresher, they want to look brighter with their skin, and they want some wrinkles gone, and also build some of that integrity back into the skin, where the skin looks a little bit more youthful.
Yes.
So for those patients, we actually do the treatment, and they're done in a series, so we might end up doing 6 treatments back to back, like every 2 to 4 weeks. We'll do a laser treatment, and that gives them a very, very good skin tightening as well as some loss of wrinkling. I would say that it's not all gone, but of course for that we use skin treatments with other modalities, of course, that we add to the laser. But it is still so far the best mode of therapy to rejuvenate the skin and stimulate that collagen production back into the aging skin, which is sagging, which is producing wrinkles and doesn't look the brightest. But like I said, my acne patients are so far the most that are benefiting from this treatment, because it is, along with their medication by mouth, they are getting a very good recovery in the scar treatment, as well as the amount of acne, the new lesions that come out, because it provides a good antibacterial approach to the skin.
And I take it the results that you just touched on as well have been very impressive through this.
Very impressive. So the acne lesions, like I said, decrease, as well as the scars that they develop after the acne is actually healed on the skin. The scar reduction is very significant.
I've come to Advanced Dermacare and Skin Solutions for some Aerolase treatments on my rosacea and I'm very pleased with the results. Dr. Bhatti and the staff are very informed, kind, just everything was up front, and I was very happy with that. I've had the Aerolase treatment. I've had 3 laser treatments, and it was painless. I actually enjoyed it. It was very relaxing. Dr. Bhatti told me what she was doing before she did it, and I was very comfortable. And the staff was very informative, gentle with me, and the cost is really reasonable. I'm very pleased with the overall results. Actually, I want to get other things done with the laser. It does the tightening, and I can wear more jewelry on my chest. It's, you know, and it's not like people are staring at my chest because it's so red. I highly recommend Advanced Dermacare and Skin Solutions for any skincare needs that you have. The staff, the products, the services, all are wonderful. And if you're a little uncomfortable, Dr. Bhatti has a way of making you feel very comfortable, and I'm very pleased with my services.
Now we're literally out of time, but I wanted to ask you before I let you go, you and your practice, Advanced Asthma, Allergy and Sinus Center here in Upper Marlboro, Maryland, have certainly established a reputation for excellence. You're one of this region's leading and top doctors.
Thank you.
And I just wanted to ask you what you feel helps separate you and your practice apart from some of the others.
Well, like you might have noticed from the way that I answer your questions, that I'm very passionate about treating my patients, and it takes a lot of courage to do that, because I think that when I'm counseling my patients on, like, say, smoking cessation, they might take offense to it. But the way I put it to my patient in a very, very gentle, loving manner, they actually take on to that, and they believe like they're working with me. Okay, so the ideal way of approaching a treatment is to let the patient know, hey, I'm a partner in this on you, okay, and I'm going to be right alongside with you. So there's that passion that goes into it, and I think the rest of my staff feels the same way that I do, and that sets me apart from other physicians that are not taking that much interest in the care of their patient. And along with that, I would say the counseling is the best way to approach a problem, so that it makes them more compliant with their treatment. So if I don't counsel them right, and I don't counsel them enough on the treatment that they're receiving, they're not going to be compliant, and they'll keep having the disease.
Well, the patients love you, Dr.
Thank
Bhatti,
you.
not only the ones we heard from today, but many others through our research. You're doing a great job. You're helping
Thank
a
you.
lot of folks each and every day.
Thank you.
And now you offer the cosmetic treatments as well
Yes.
through your laser that
Yes.
you offer here. And I just wanted to thank you for joining us, educating
so
us,
much.
being a guest on our program. We'd love to have you back on in the future.
Thank you so much for having me.
Thank
we
you.
appreciate it.